This video is for the crown delivery video. We're going to start off, we have a mirror. This is used to examine the mouth. This is our Explorer, and this is what we're going to use to check for any decay, any abnormalities. We're going to have a probe that's going to be used to check the gingival margins. We have a spoon, and this is to clean out the excess tooth structure from the prep. Our comb pliers used for indirect retrieval or retraction of cotton rolls. We have a condenser, and this is what condenses the material into the crown. We have a Woodson, and that's used to burnish and smooth. We have our cotton tip applicator that we're going to use to place the topical. We have our hemostats, and that's used to grab tissues and bone fragments, or to grab the crown temp off the tooth. We have our IRM powder and our IRM liquid with our spoon that we'll use to measure the powder out, that we use as the cement for our crown. We have our air water tips used to rinse and dry. We have our HV and our saliva ejector used to suck up blood, saliva, and then our HV, the same thing except to clean up debris from the prep. Our shade guide that we're going to use to pick out the tooth, or the shade of the tooth. We have our needle and our anesthetic aspirating syringe that we will give to doctors so we can administrate the numbing agents. Our burr block that has the burrs per dentist preference, articulating paper and holder that we'll use to check the occlusion after we have it cemented down and in place to make sure that it's sitting right. This is our topical that we'll use before we do the numbing agent that the doctor will use. We have our wooden bite stick, and that's what we're going to use to help seat the final crown. So after we have it in the mouth, we're going to have the bite on that just to make sure it's in there all the way. We have our mixing pad that we're going to use to mix our IRM, and then our stainless steel crown that we'll use to place on the tooth. We have our 2x2 gauze that we'll use to dry the area before we place topical, or to get cement or materials off of instruments. And then we have cotton rolls that we'll use to retract and isolate, and have them bite down to help seal it if we don't have a wood stick.